Hello and welcome to this short webinar on the Arizona Medicaid occupational therapy coverage. My name is Zachary Edgar, and my company is called Therapy Comply. Therapy Comply is a membership-based compliance firm dedicated to assisting physical, occupational, and speech therapy practices and facilities. Members can access a wide selection of guides, sample policies, and forms on Medicare, Medicaid, HIPAA, TRICARE, and state laws and regulations that apply to therapy practices. Members can also email me at any time with any compliance or billing questions or schedule a phone call for no additional cost. Please visit the website at therapycomply.com for more information. This presentation is for informational purposes only. None of the material is intended as legal advice. Statutes and regulations are all subject to change. This presentation describes the Arizona Medicaid fee-for-service coverage of occupational therapy. Medicaid managed care companies must offer the same amount of care as the state, but can change prior authorization, personnel, and documentation requirements. MCOs do follow state rules in many cases, but therapists should always double check. On the website, we have more information on outpatient therapy services, fee schedules and code lists, billing for non-covered services, information on qualified Medicare beneficiaries, information on the managed care plans, and members can always request information or ask any questions about Medicaid coverage and compliance. Occupational therapy is defined as medically ordered treatments to improve or restore functions which have been impaired by illness or injury, or which have been permanently lost or reduced by illness or injury, or to attain or acquire a particular skill or function never learned or acquired and maintain that function once acquired. OTs is intended to improve the patient's ability to perform those tasks required for independent functioning. Occupational therapy services must be provided by a qualified occupational therapist or by an occupational therapy assistant under the supervision of an OT within their scope of practice and consistent with Arizona's rules and regulations on occupational therapy. Access covers medically necessary OT services provided to all patients who are receiving inpatient care at a hospital, nursing facility, and custodial care facility when services are ordered by a patient's PCP, attending physician. Inpatient OT consists of an evaluation and therapy. Outpatient settings include, but are not limited to, therapy clinics, outpatient hospital units, federal qualified health centers, physician offices, and home health settings. In order for occupational therapy services to be covered, the services must be ordered by the PCP, primary care physician, or attending physician, and the patient must have the potential for improvement. The individualized plan shall be reviewed at least every 62 days by the patient's PCP, attending physician, or non-physician practitioner. For adults, outpatient occupational therapy services are covered for acute patients 21 years of age and older as follows: 15 O visits per benefit year for the purpose of restoring a skill or level of function and maintaining that skill or level of function once restored, and 15 visits per benefit year for the purpose of acquiring a new skill or new level of function and maintaining that skill or level of function once acquired. Medically necessary OT for both restoration and acquisition may be provided in the same contract year, but the 15 visits limits apply for each category above. For children, outpatient OT services are covered for AHCCCS patients and patients under the age of 21 when medically necessary. Occupational therapy services may include, but are not limited to, cognitive training, exercise modalities, hand dexterity, hydrotherapy, joint protection, manual exercise, measuring, fabrication, or training in the use of prosthesis, arthrosis, assisted device for splint, perceptual motor testing and training, reality orientation, restoration of activities of daily living, sensory reeducation, and work simplification and/or energy conservation. Rehabilitative therapy. A therapy service shall be reasonably necessary to the functional development and/or treatment of the patient's illness or injury. If the patient's expected potential for improving or restoring functional level is insignificant in relationship to the type and number of therapy services required to achieve such potential, then therapy is not covered for other than a maintenance program as described below. If at any point in the development of skills or the treatment of an illness or injury it is determined that the therapy expectations will not materialize, the services will no longer be considered reasonable or necessary. If the development or restorative potential is evaluated as insignificant or at a plateau, an appropriate functional maintenance program shall be established. The specialized knowledge and judgment of a qualified therapist shall be required to assess and establish the maintenance program to achieve the treatment goals of the ordering PCP or attending physician. After the patient's condition has been assessed and the patient or patient's caregiver may be instructed or trained as appropriate in the established maintenance program components, the services of a qualified therapist are no longer covered except for reassessments and treatment plan revisions. Prior authorization. For acute fee-for-service patients who receive occupational therapy in an inpatient setting, the prior authorization for therapies is included in the facility authorization. No prior authorization is required for covered outpatient occupational therapy services for acute fee-for-service patients. Prior authorization may be required by a Medicaid managed care company. Thank you for watching, and please like and subscribe to our channel, and please visit us at therapycomply.com for more information and consider joining today.